Bismillahirrahmanirrahim. Quote of the day is treatment without prevention is simply unsustainable. Today the topic of my presentation is rabies and I am presenting it under the supervision of my professor Dr. Saira Afzal. Learning outlines are introduction of the disease, epidemiological determinants, clinical manifestations, levels of prevention, recent updates and MCQs at the end. Learning outcomes are at the end of this presentation, participants will be able to describe about the elements of animal rabies control, elements of human rabies prevention, basic issues on rabies prevention and control, national and global updates. Introduction. It is a highly fatal disease of CNS. It is caused by Lissa virus type 1. It is a zoonotic disease of warm-blooded animal. It is transmitted by bites of rabid animal, long and variable with short period of illness. No treatment is found, only prevention is there. Epidemiology of the disease. First is agent rabies virus. Size of the virus is 180 into 75 nanometer. It has lipoprotein envelope. It has knob-like spikes or glycoprotein G. It has M protein layer. Genome is unsegmented, linear, negative sense RNA. Surface spikes composed of glycoprotein G produces pathogenicity by binding to acetylcholine receptors in the neutral tissues. It stimulates T lymphocyte cytotoxic effects. It also has hemoglobinating activity. This picture shows the structure of rabies virus, that how it is having a glycoprotein layer, matrix, lipid bilayer, phosphoproteins, large proteins, and the RNA complex. Types of rabies virus. There are two basic types, straight virus or fixed virus. Straight virus. The virus recovered from naturally occurring cases of virus is called straight virus. And the virus which has a short, fixed, reproducible incubation period is called as fixed virus. Source of straight virus is that it is naturally occurring virus. It is found in the saliva of infected animal. While source of fixed virus that it is prepared by repeating cultures in the brains of rabbits, such as its IP is reduced and fixed. Features of the street virus are that it produces negri bodies, incubation period is 20 to 60 days. It's pathogenic for all mammals and it cannot be used for preparation of vaccine. While for fixed virus, it does not form negri bodies. The incubation period is constant between 4 to 6 days. It can be pathogenic for humans under certain conditions only, and it is used for preparation of anti-rabies vaccine. Source of infection. Source of infection, main source is the saliva of rabid animal. Dogs and cats virus in saliva 3 to 4 days after clinical symptoms. Host factors. All warm-blooded animals, including men, are host factors. Rabies in a man is a dead-end infection. People at risk, lab workers, dog handlers, and hunters, all are the factors that are involved. Rabies is 100% vaccine preventable. To stop the transmission, vaccination should be done to all the people. Mode of transmission. 4 factors are involved: animal bites, licks, aerosols, and person-to-person transmission. Incubation period normally is 3 to 8 weeks, may be short, that is 4 days, or may be prolonged for years. However, it depends on the site of bite, severity of bite, number of wounds, amount of virus injected, species of biting animal, protection provided by clothing, or the treatment taken or not. This picture shows that infection bite wound leads to virus multiplies here in monocytes for weeks and months. Then virus travels to the peripheral CNS. Then from here multiplies in the central CNS, causes encephalitis. Virus moves out through peripheral and cranial nerves, and then it spreads towards salivary glands, skin, mucosal surfaces, gut, and most other organs. Pathological lesions in brain, Negri bodies. These are the Negri bodies that are caused by the bite of rabies virus. Symptoms of the disease. Symptoms are headache, fever, sore throat, nervousness, confusion, pain or tingling at the site of bite, hallucinations, hydrophobia, paralysis, coma, and death. The clinical findings may be bizarre behavior, agitation, seizures, difficulty in drinking. Patients will be able to eat solids. They will be afraid of water, that is hydrophobia. Spasm of the pharynx produces choking. Death may occur in 1 to 6 days. Respiratory arrest, death, and some, however, can survive. There are 4 stages of rabies infection. First is non-specific prodromal. Second, acute neurological encephalitis. Third is coma, and fourth, death. Diagnosis. The primary diagnosis of rabies relies on clinical presentation and history of exposure to a suspect rabid animal. Now, what is a suspected case? A case that is compatible with clinical case definition. Probable, a suspected case plus a reliable history of contact with the suspected. Probable or confirmed rabid animal. Confirmed case is a suspected or prodromal case that is laboratory confirmed, usually postmortem. Key facts about rabies. Rabies is a vaccine preventable viral disease which occurs in more than 150 countries and territories. Dogs are the main source of human rabies deaths, contributing up to 99% of all rabies transmission to humans. Globally, rabies causes an estimated cost of US dollar about 8.6 billion per year. 40% of the people bitten by suspect rabid animals are children under 15 years of age. Immediate thorough wound washing with soap and water after contact with the suspect rabid animal is a crucial and can save lives. WHO leads the collective United Against Rabies to drive progress towards zero human deaths from dog mediated rabies by 2030. Uh, now, World Rabies Day is celebrated on September 28th. Rabies prevention and control. It has 2 components. Uh, Animal rabies control and human rabies prevention. Animal rabies control is the primary preventive measure, and it is a measure that is used to prevent the disease at source. And human rabies prevention is secondary prevention measure. Then elements of animal rabies control, 3 basic elements are involved. First is mass vaccination of dogs. Second is movement restriction, confinement. And third is the control of stray dogs. Mass vaccination of dogs. Animal pre-exposure vaccination. For effective control, at least 75 to 80% of the population should be vaccinated. And it should be done at regular basis. Movement restriction or confinement, isolation and observation. Periods for 10 days for dogs and cats, suspect rabid animal. Animal quarantine, that is 6 months. Animal exposed and previously vaccinated. Euthanasia of unvaccinated animals if exposed. If a person got bitten by a stray dog, the wound should be washed and left open for secondary closure. Measures for stray dog control. First is create responsible dog ownership among the community, dog registration and identification, mandatory rabies vaccination and traceability, environmental control, excluding the dogs from the sources of food, for example, rubbish dumps, and installing animal-proof rubbish containers. Human dog population management, animal birth control. Euthanasia means that the act of inducing death in a inhuman manner. Control of dog movements, for example, leash laws, roaming restrictions should be done. Elements of human rabies prevention. Avoiding exposure, avoiding contact with unknown animal, nursing rabid human animal with care. Pre-exposure prophylaxis and post-exposure prophylaxis. Pre-exposure prophylaxis is recommended for anyone who is at continual, frequent, or increased risk of exposure to the rabies virus, such as laboratory workers, veterinarians, and animal handlers. Post-exposure prophylaxis, anti-rabies prophylaxis administered after an exposure. Rabies, it's time to act now because it can only be prevented and cannot be treated. Vaccination. Since 1984, WHO has strongly recommended discontinuation of production and use of nerve tissue vaccine and their replacement by modern, concentrated, purified cell culture and embryonated egg-based rabies vaccine. Nerve tissue vaccine can induce severe adverse reaction more frequently and are less immunogenic than CCVs. WHO recommendations apply only to inactivated CCVs. Since the early 1960s, it has been administered to millions of people worldwide. CCVs are intended for use in both pre-exposure prophylaxis and post-exposure prophylaxis. All CCVs should comply with the recommended potency of more than or equal to 2.5 international units per dose for intramuscular injection, 0.5 ml or 1 ml volume after reconstitution, depending on the type of vaccine. Rabies vaccines are currently available only in single dose vial and do not contain preservatives. Evidence supports administration of CCVs by intradermal or intramuscular injections. A systematic review of vaccine potency has shown that the current vaccine dose, that is 2.5 international unit IM in a single dose and administered by the intradermal route for either pre-exposure or post-exposure prophylaxis, have efficiency equivalent to or higher than that of the same vaccine administered through IM route. For intradermal route, one dose is 0.1 ml of CCVs. The vaccine in one vial can therefore be fractionated to provide 5 to 10 doses of intradermal administration, depending on the vial size, 0.5 ml or 1 ml. For the intramuscular route, one dose is one vial of vaccine per patient. The concentration of antigen-presenting cells in the dermis is responsible for strong immunologic response to vaccine administered, despite the lower volume of antigen injected. Intradermal administration of rabies vaccine provides a cost-saving and dose-sparing alternative to intramuscular vaccination. Intradermal post-exposure prophylaxis regime use at least 25% less vaccine. As the number of patients seen in the clinics increase, intradermal regime becomes increasingly cost-effective, using up to 85% less vaccines while. Post-exposure prophylaxis. It consists of the following steps. First is all bite, wounded, scratches, and rabies virus exposure sites should be attended to as soon as possible after the exposure. Thorough washing and flushing of the wound for approximately 15 minutes with soap or detergent and copious amount of water is required. Where available, an iodine containing or similarly a varicidal topical preparation should be applied to the wound. A series of rabies vaccines injected should be administered promptly after exposure. Rabies immunoglobulins should be administered for severe category like type 3 exposures. Wounds that require suturing should be sutured loosely and only after rabies immunoglobulin infiltration into the wound. WHO recommends post-exposure prophylaxis for category 2 and 3 of exposure. WHO rabies exposure categories are category 1, that is touching or feeding animals, animal licks on intact skin, no exposure. Category 2 is nibbing of uncovered skin, minor scratches or abrasions without bleeding, that is exposure has been happened. While category 3 is single or multiple transdermal bites or scratches, contamination of mucous membrane or broken skin with saliva from animal licks, exposures due to direct contact with bats, severe exposure. WHO rabies exposure categories, intradermal post-exposure prophylaxis schedule are cost and dose sparing, and cost effectiveness increases with the number of patients seen in clinics. If a repeat exposure occurs within 3 months of completion of post-exposure prophylaxis, only wound treatment is required. Neither vaccine nor rabies immunoglobulins are needed. Should a vaccine dose be delayed for any reason, the post-exposure prophylaxis schedule should be resumed. Now it shows the recommendation of the post-exposure prophylaxis according to the category. If immunologically naive individuals of all age groups, if they are in category 3, they should be given vaccination immediately along with wound washing and, other rabies immunoglobulin are given in category 3, while these are not given in category 2. Otherwise, the treatment in both the same. Previously immunized individuals of all age groups. If they are in category 1, wash exposed skin service and no exposure is required. Category 2 shows that rabies immunoglobulin is not indicated, otherwise vaccination intradermally or intramuscular should be given along with wound washing. First category shows the type of contact, touching or feeding of animal, licks on intact skin, and contact of intact skin with secretions, excretion of rabid animals, human case. Second category, wound management and anti-rabies vaccine is required. While in third category, wound management, rabies immunoglobulins, and anti-rabies vaccines are all required. Rabies immunoglobulin administration. Rabies immunoglobulin administration provides passive immunization and is administered only once, as soon as possible after the initiation of post-exposure prophylaxis and not beyond day 7 after the first dose of vaccine. Correctly administered rabies immunoglobulins neutralizes the virus at the wound site within a few hours. Rabies immunoglobulin is less costly than human rabies immunoglobulin. Both have shown similar clinical outcomes in preventing rabies. The rabies immunoglobulins products are now highly purified. Skin testing before administration is unnecessary and should be abandoned. To confer the maximum public health, WHO recommends the following. The maximum dose of human rabies immunoglobulins is 20 international units and 40 international units for the other immunoglobulins per kg body weight. There is no minimum dose. Infiltrate as much as possible into the wound. The remainder of the calculated dose does not need to be injected IM at a distance from the wound, but can be fractionated in smaller parts. Individual syringes to be used for other patients. Pre-exposure prophylaxis. Pre-exposure prophylaxis is the administration of several doses of rabies vaccine before exposure to virus. Pre-exposure prophylaxis is recommended for individuals who are at the higher risk due to occupation. Pre-exposure prophylaxis should be considered in subpopulations living in remote rabies endemic areas where access to post-exposure is difficult and the incidence of dog bite is more than 5% per year. For immunologically naive individuals of all age groups, WHO recommends the following pre-exposure prophylaxis schedule. 2 sites intradermal or a 1 site intramuscular vaccine administered on day 0 and day 7. A routine pre-exposure prophylaxis booster or serology for neutralizing only for continued high risk of rabies exposure remains. Individuals with documented immunodeficiency should be evaluated on a case-by-case basis and best receives an intradermal or intramuscular pre-exposure prophylaxis schedule, plus a third vaccine administration between days 21 to 28. Additionally, in the event of an exposure, a complete pre-exposure prophylaxis course, including rabies immunoglobulin, is recommended. Requirement for rabies prevention and control. It should be backed by legal framework, allocations of resources, availing vaccines and rabies immunoglobulin, expand diagnostic service, surveillance system, skilled manpower, collaboration among stakeholders, and community education and participations are required. Now, recent updates. In Pakistan, 2,000 to 5,000 cases per year are found. Rabies is endemic in Pakistan. Human rabies is not a notifiable disease in Pakistan. The main vector for rabies in Pakistan is the domestic dog. An article recently published in the news shows over 50,000 citizens are bitten by stray dogs everywhere in Karachi alone. Every year, around 50,000 citizens in Karachi are bitten by stray dogs. There is a need to vaccinate at least 70% of the stray dogs in the city to achieve herd immunity against the rabies instead of culling the canines. Our plan is to eliminate rabies from the soil of Pakistan in the next 10 years, which looks an ambitious target, but it is achievable. Another article published is Punjab's stray gets a new deal. It shows that the previous thing was, according to WHO, it identifies several disadvantages to poisoning or killing of the dogs. It is detrimental to our ecosystem as dog care cases lie on the ground for many days. Pollution, both air and soil. Killing stray also means those animals and insects that become food for all dogs will increase. And they should also inform that the US, Europe, and neighboring Indians have all banned the killing of dogs. However, the new policy is, according to the sources familiar with the details, the new policy involves several steps. Firstly, the staff of Metropolitan Corporation will rescue the dogs from their district and register them. Then the dogs will be handed over to livestock veterinary center where male dogs will be neutered and female dogs will be operated on to disable their ability to reproduce. After that, they will be vaccinated against rabies. Once these steps have been dealt with, the male and female dogs will be released into natural environment and their birds will no longer pose a risk of rabies and their population will be controlled. Now MCQs. First MCQ is rabies is a highly fatal disease of CNS that is caused by Lyssa virus type 1 and is associated with encephalitis and hydrophobia, leading to coma and death sometimes. Which among the following is true for rabies? Option A is rabies is not prevented by pre-exposure prophylaxis. Option B, death rate is highest in the elderly. Option C, all vaccines can be used intradermally only. And option D, deaths have occurred post-transplant. Option D is the right one. Deaths have occurred post-transplant. Second MCQ is a person XYZ was bitten by a stray dog and in next 3 days he feels tingling sensations around the wound and unusual pain. He got frightened and came to nearby tertiary care setup. There he was given injections of immunoglobulin. Which of the following is representing this immunoglobulin? Option A, it is only manufactured as human immunoglobulin. Option B, at least half the dose should be infiltrated around the wound. Option C, can only be given within 1 week of bite. And option D, if you are really concerned, it can be given IV in a very high risk case.
C.
Option B is the right one. At least half the dose should be infiltrated around the wound. Third MCQ is WHO has strongly recommended discontinuation of production and use of nerve tissue vaccine and the replacement by modern concentrated purified cell cultures and embryonated egg-based rabies vaccine. However, CCVs can be given as option A, pre-exposure prophylaxis, option B, post-exposure prophylaxis, option C, pre and post-exposure, and option D, it should be given only to the terminally sick patients.
C.
Yes,
B.
C is the right answer, pre and post-exposure prophylaxis. Fourth MCQ is a person ABC loves to travel and is a car driver per profession. Traveler comes to the clinic after getting 2 doses of vaccine 6 months ago, and next week is traveling to an endemic area for rabies. What should a physician do? Option A, start the scheduling again and get him to cancel his trip. Option B, give 1 dose of vaccine and assume he is good cover. Option C, order the same vaccine and he used and give him one extra dose. And option D, assume he already had enough cover.
B.
Yes, option B is the right one. Fifth MCQ is a 19 years old threatened college colleague came to the DHQ hospital, Sahiwal after a minor bite of former's dog in the playground of college. Upon inquiry, he was told that the dog bites him when he went near the dog to pick his ball. Dog's owner told him that the dog is not vaccinated. However, the dog is otherwise healthy. He is worried about getting the rabies and wants to get vaccinated for rabies. How will you counsel this boy regarding vaccination? Option A, that all dog bite vaccines should get rabies vaccine. B's advise him to observe the dog for any illness in the dog for 1 week. Option C, no need in minor bites. And option D is no use of vaccination after exposure.
B.
B.
Yes, B is the right one. Sixth MCQ is a 40 years old uh, man came to the emergency at 2 a.m. After a bite of the stray dog while he was going to home from the railway station. He got 2 into 3 centimeter wound on his right arm. What immediate step is needed regarding his wound management? Option A, apply suture and advise him to change the dressing daily. Option B, wound wash and with normal saline and apply suture. Option C, wash the wound with normal saline and let it open for secondary closure. Option D is apply bandage and prescribe broad spectrum antibiotics.
C.
C.
Yes, option C is the right one. A wound should be let open for secondary closure. Seventh MCQ is rabies is a vaccine preventable viral disease which occurs in more than 150 countries and territories. 40% of the people bitten by a suspect rabid animal are children under 15 years of age. To prevent rabies, which among the following public health measures are best? Option A is kill all stray dogs. Option B, vaccinate all dogs. Option C, add rabies vaccine to country's immunization schedule. And option D, capture all animals that bite to observe them for 15 days to guide medical management.
B.
B.
Yes, B is the right one. Eighth MCQ is the rabies virus is an agent of size 180 to 75 nanometer, has lipoprotein envelope, M protein layer, and is passed on by contact on which part of the infected animal? Option A, skin, B, saliva, option C, blood, and D, claws.
B.
Yes, option B is the right one. It is saliva. Ninth MCQ is a villager from southern Punjab brought to tertiary care hospital in Lahore with restlessness, irritability, agitation, fear of annoying voices, bright light, water, and food. His pet dog bites him 7 weeks ago, which later dies after a few days. Choose the correct option in this diagram. Option A, start the course of rabies vaccine and immunoglobulins. Option B, treat him for some other disease as he is not suffering from rabies as there is a long time past when the dog bites him. Option C, there can be a better health outcome if he is properly treated. And option D, patient's life cannot be saved.
D.
D.
Option D is the right one because in this situation, the patient has got the disease and there is no treatment further because the time for immunoglobulin has also passed in this scenario. 10th MCQ is a man is bitten by a high pet dog in Lahore. He notices a strange behavior in his dog from few days that he's not eating well, extreme aggression, unusual bark, and excessive salivation and fear of water. Choose the best option regarding the medical management of this victim. Option A, patient's life cannot be saved with any measure. Option B, patient's life can be saved if proper and timely vaccine immunoglobulins are administered. Patient's life can be saved if vaccines and immunoglobulins are administered after the onset of rabies symptoms. And option D, no use of vaccine and immunoglobulins once a rabid dog bites humans.
B.
A.
Option B is the right one. This is the key, and thank you.